No matter how you measure sympathetic nervous system activity in fibromyalgia, it's abnormal. This video looks at studies that measure the level of sympathetic nervous system activation that occurs when the body is responding to changes in position, things like standing up. This process is actually a bit of a Goldilocks situation for the body. It needs just the right amount of sympathetic nervous system signals occurring at just the right time in order to make all the necessary adjustments in blood vessel tone, heart rate, and blood pressure so that our body actually can tolerate that change in position. And you will not be surprised to know that we tend to have problems in this area in fibromyalgia. The sympathetic nervous system is hyperactive in fibromyalgia, and in my opinion, it's this abnormality that causes a chain reaction that ultimately leads to all the other symptoms of fibromyalgia, including fatigue and brain fog and pain. I'm Dr. Ginevra. I'm a physician. I have fibromyalgia myself, and I've dedicated my career to figuring out this incredibly frustrating illness. I share my findings with you here in my research library and in my book, The FibroManual. So when the body moves from a lying or seated position to standing, the effect of gravity causes pooling of blood in our legs. And if the body does not compensate for that, it means the brain is not going to get as much blood flow. And your brain really likes its blood flow. A brain starved of blood flow sends out messages like dizziness and nausea or even fainting. So why do most healthy people stand up with no problem? Well, when a healthy person stands up, their brain briefly activates the sympathetic nervous system, kind of hits the accelerator really quickly, and this increases how fast and how hard the heart is pounding, tightens blood vessels in the lower legs, and together these changes act to prevent a significant drop in blood pressure and maintain adequate blood flow to the brain. And we go about our business not thinking much of it. But in fibromyalgia, our sympathetic nervous system is not as good at generating these changes. And so we tend to experience symptoms like low blood pressure and even fainting. In one study, over 60% of patients reported having symptoms upon standing, including things like lightheadedness, tunnel vision, sweating, nausea, and about 12% reported even fainting with standing up. So one way to test how well the sympathetic nervous system is responding to standing is first by just measuring blood pressure and heart rate and symptoms while lying down, and then doing it again while standing. This definitely gives us some really useful information, but the picture is clouded by the fact that when we stand up, we also tighten muscles in our legs, and that also acts to boost blood pressure, but not really through the sympathetic nervous system. So to isolate down to just what the sympathetic nervous system is doing in response to position change, not what the sympathetic nervous system plus leg muscles are doing, we have to look at what's called a passive standing test. This can be achieved during a tilt table, also called a head-up tilt test. It involves being strapped to a table, which is then slowly elevated through a variety of different angles, usually to about a 70-degree head-up angle. All the while measuring heart rate and blood pressure and also the electrical activity of the nerves that are sending out the constrict signals down to blood vessels in the legs. Those nerves are sympathetic nerves, so we can see how active or how much the sympathetic nervous system is able to send that constrict signal down. And yes, this testing is as unpleasant as it sounds. Early in my career, I worked in an academic setting and had easy access to getting tilt table testing. It's actually a little bit challenging to do normally in the outpatient setting. But because I had easy access to it and, I was a new clinician and I noticed that most of my patients had issues with, dizziness or lightheadedness upon standing, I was ordering this for almost every patient. But then I was getting the feedback of just how miserable this test is. It's really unpleasant. I mean, if you have to get it, but I learned early in my career to be really selective about when to order a tilt table. So not every study, but lots of different studies have found that people with fibromyalgia have abnormal responses to tilt table testing. About 60% of fibromyalgia patients show abnormally fast heart rate or a drop in blood pressure during the tilt table testing. One study found that almost half of fibromyalgia subjects actually fainted right there on the table during the testing. And you can see in this table, I've summarized some of the research findings. So beyond symptoms, we can look even more closely at the sympathetic nervous system activity and what it's doing in response to position change by measuring the electrical signals coming down from the brain, down the sympathetic nerves, out to the blood vessels. So normally, to adjust to changes in position, the body's response is to send more signals down the sympathetic nerves, and that tightens the blood vessels. And we can measure this, and it's called the MSNA. You can measure it by inserting a needle electrode into a nerve and then reading how fast the electrical activity is pulsing, or it's also called a burst rate. So in this study, you can see on the left-hand side, they looked at healthy controls. And in this case, at rest, their MSNA was normal. It was low, around 12. And then in response to the tilt table, as it goes up, their MSNA does exactly the right thing. It dramatically increases its burst frequency, and you get more electrical activity being sent down. And so people can compensate, their blood vessels can constrict, and they tolerate the test just fine. So the controls in this study had no issues. But then if you look on the right-hand column and you see what's happening in the fibromyalgia body, it's a very different story. So at rest, our MSNA is already going pretty high. It's almost double what a healthy person's is going at rest. So we're already running at a pretty high speed. And so then when we need more increased activity sent down the electrical pathways, there's actually not much room to go up. It's sort of like, the difference between if you're going down the highway and you're 50 miles per hour and you hit the accelerator, there's a lot of room to speed up. You can go pretty significantly faster than 50 miles per hour. But if you're already going 100 miles per hour and then you hit the accelerator, you're not going to get much bump. The car's only going to go up to maybe 120 miles per hour, which I don't recommend any of this, but as an example, you can see we don't have much room going up. So when our body does need a big sympathetic response, we don't actually get that MSNA spike up like it needs to, and we don't get the desired response of quick blood vessel contraction. We just get a really weak, ineffectual bump of a measly 2 points. So to sum up, fibromyalgia patients show autonomic nervous system dysfunction in the form of abnormal responses to both active and passive changes in posture. This contributes to common symptoms of fibromyalgia like fatigue and brain fog and low blood pressure upon standing. You can find more in-depth coverage of this topic, including references, at fibroresearch.org. There you can also join my mailing list to be kept updated as new fibromyalgia studies come out. For treatment information, head to my book, The FibroManual, which was just released as an audiobook. I'm super excited about that, so check that out as well. I hope this video is helpful in your journey to understanding fibromyalgia better. Thank you for watching.